Hopefully you can hear me clearly. So I am Malkia Buga and I'll be moderating this webinar today, and I'm the current head of health planning at Nairobi City County Government and also part of the scientific committee for the second upcoming Nairobi Health Scientific Conference. We welcome you all to this second webinar, which is in the preparation to our second Nairobi Health Scientific Conference, that it will be happening here in Nairobi from 5th to 7th November 2025. And this second conference is going to be bigger, better, and very transformative. And we expect to have over 700 delegates. So we can't wait to have you there. So this year's theme for our scientific conference is Advancing Universal Health Coverage Towards the Attainment of Sustainable Development Goals 2030 for Nairobi. So we are inviting all of us to submit abstracts in various sub-thematic areas. We have 6 of them. The first sub-theme is on innovation and technology in health, sustainable health financing, genomics and emerging science in health, population health and system strengthening, environmental health and climate change, partnerships and collaborations in health. Our abstract submission is still open until 1st September 2025, and we will be sharing some of those details in the chat, and also you can be able to check our Nairobi City County website for additional information. So this is a follow-up to our webinar that we had last week, and now it is my pleasure to introduce our today's speaker. Our speaker is Dr. Patrick Opio Owili. He is a program manager for research and capacity strengthening at African Population and Health Research Center, commonly known as APHRC. Dr. Patrick has led major international health projects on multimorbidity, sexual reproductive health, data ecosystem, among many other health interventions. Dr. Patrick holds a PhD, 2 PhDs actually, in public health and environmental science and technology, and he has won the International Reisenstein Award. He is very passionate about mentoring researchers and generating evidence to inform policy and improve health systems globally. In today's webinar, he will be sharing with us valuable insights on how to write an impactful conference abstract from the lens of the reviewers. So whether it is your first time to submit an abstract or you're a seasonal researcher, we hope this session will be beneficial to all of us. And for us to be eligible for the CPD points, we need to be in the session for at least an hour. And we request that all participants drop their questions in the chat, and our conference committee members will be responding, and our speaker will address issues related to the presentation and anything related to abstracts submission. So it is my pleasure to welcome Dr. Patrick to take us through this session. Karibu sana, Daktari.
Yeah, thank you so much, Malkia, for those kind words you had about me. Just confirm if you can be able to see my face.
Yes.
Okay, you'll allow me to turn off the video so that at least it can save the data bundle for other people who are within the meeting. I am in a different setup because I had another in-person meeting in a particular hotel. So I'm actually in a hotel setup. In any case, you hear some background noise, please bear with me. So kindly confirm, Malkia, if you are able to see my slide.
Yes, we are.
Okay, great. So I guess this is one of the most important things that we are talking about today, writing a conference abstract. One of the things Malkia did not mention is that I'm a vice president for ASRA Africa. And part of my mandate as the vice president, I organize and coordinate conferences, and as well as train reviewers of abstracts who definitely, making sure we have very wonderful conference abstracts, as well as new innovation that is able to advance a specific thematic area. And so it is very, very important. It is my pleasure to take this moment and just share with you briefly from a reviewer's perspective what we do look at when we are reviewing a conference abstract. And this will be able to guide you in one way or another to put your conference abstract in a much better shape than what you think. So I am turning all of you to be reviewers so that you can be able to, write your conference abstract from the reviewer's perspective, how we actually review the conference abstract. And so the objective of this kind of webinar, we want you to understand the key components of an abstract, because some of the times we always receive abstracts that do not have some of the key components that we are looking for. And when we are looking at the structural component only, then some abstracts can actually be disqualified from being accepted into the conference. And we want you to also write an abstract from a reviewer's perspective. Think like a reviewer and make sure that you are aligning your conference abstract to the particular themes that are associated with that particular conference. So what's an abstract? What's an abstract, or rather the empirical scientific abstract? This is actually a summary. It's a summary of an original research. An abstract, be sure it's a summary. And how can you be able to use few words to tell the world what you are doing? It necessarily does not mean that you have to use 10,000 words. Like in a thesis, probably some institutions require you to have, 20,000 words. And can you be able to summarize the entire 20,000 words you have, or probably a particular research project, into fewer words and tell the world what you are doing? And this abstract, and a scientific abstract, is actually based on a particular data, and that data must have been measured or observed somewhere, and you are somehow, telling the world, and you're telling those particular experts in that particular field, area of speciality, that this is what we have observed. This is what we measured, and we found out A, B, C, D. And it needs to be able to answer a specific, listen to that, a specific research question. It doesn't have to answer, almost everything. Sometimes for early career researchers, they want to, do the whole world. They want to promise. But a conference abstract basically is targeted. What is the specific thing that you are looking at? You don't have to answer 100 questions or 5 or 6 questions in a particular conference abstract. And that's why you really need to be limited, because you have to summarize that original research into fewer words that will be able. And so the choice of words is very, very critical. And also it includes the methods aspect of it. To how did you conduct that particular study, and what did you find out? And what you found out is very, very critical, especially to the reviewers. They want to see, is there anything new that is coming out from what has been done, and the method that has been used? Is it an empirical method? Is it a method that we can simply say that this is adequate? You might be having a good research question, but the method, or the technique, the approach you are using might be, shoddy, and that would really dilute the findings of your study. And so those are very, very important things that you need to know. And so these are key elements when you are writing your conference abstract. Be sure these key elements are very, very critical. We have to look at your title. And what is your title? And is your title aligned to the thematic areas that have been identified? Basically, make sure when you are writing your conference abstract, be sure you are targeting a particular theme or sub-theme that is associated with that conference, and you can't be talking about Z while somebody else, the owners of the conference, want A, yet you are talking about Z. It doesn't align well. Basically, those are some of the things which are first of all looked at. Is the title actually specific to a particular sub-theme, and who are the key specialty? By the way, let me tell you, when we have those thematic areas, we as experts, we have identified key experts in those particular areas, key researchers who are well versed in that particular thematic area, and we are going to give them your conference, your abstract, to be able to review. And so be sure there are people who are knowledgeable in a particular thematic area. And if they are knowledgeable in a particular thematic area, get to know that whatever you are presenting, you're presenting something that, don't assume that you are the only one who knows whatever is going on in that particular area. And so the background and rationale. One of the mistakes that people do in the background and rationale, they make that to be the whole basis of their conference, paper or other abstract. They actually write giving us a lot of the background, and that is not the main thing. Those who are going to review your conference abstract already knows those things you are trying to tell them. They are so much interested in the findings that you have in your study. Why are you doing this? That's the rationale. Why are you doing this? Are you doing it for the sake of doing a research, or there is something prompting you to do this particular study? And so the background is very critical, and the research objective. Once we have evaluated your title, your background and rationale, we look at your research objective, and be sure your title must be associated with the rationale, must be associated with the objective, and the method that is going to be applied must be actually very, very critical in answering that particular objective, because the approach you use may not necessarily mean it's the best approach to answer that particular objective. If I'm talking of a how question, I would not go for a quantitative method. That would definitely be a qualitative study. And so you really need to be well versed with the methods, the type of research designs that are there. If you are an epidemiologist, you definitely know the hierarchy of evidence. We have to be able to check on the hierarchy of evidence. And so getting to know the kind of scientific approach or study design is very, very critical for your abstract. And then the finding, the main important thing that we are going to present in the conference is telling these experts, hey, these are the things which have been done. And, in our study, we found out something very interesting in this aspect. And that is the essence of a conference. The researchers, the experts in that particular area, the people who are in that particular field, they want to know the new findings that are coming out of that particular field. And so what is it that is coming out? What is it that is new? They want to know so that when they go back in developing their kind of a study, they can cite you. And some of the organizations like the EU, if you are presenting a conference abstract, they publish the conference abstract in peer-reviewed journals. And so people can be able to cite you. And so are you able to be cited that, you know, we have this study, even though you have not published it, but that conference abstract can be cited in one way or another. And so, and the new findings that are coming out of it are very critical for the experts in that particular field. They want to know the new developments that are rising. And so interpretation of your finding is also, you might be having good results, but how you are interpreting it is so weird and so awkward. And, you know, and also giving us an inappropriate conclusion. And so you need to be careful enough when you have found some particular results. What does it mean to you? What does it mean to the researchers in that particular field? What does it mean to policymakers? What does it mean to, you know, even educators, depending on where you are focusing on? What does it mean to the field of study? And so that really needs to come out so clearly while giving your conclusion as well. And finally, last but not least, you need to also present, policy implication. How will it help the policymakers? How will it help the health system? How will it help, you know, practice? How will it help us to do ABCD? That really needs to come out, as well as the keywords. So when I am looking at your conference abstract, I will definitely, first of all, look at the structure and figure out your structure. And if your structure is not adequately, you know, sufficient, I might decide, if assuming we have an international conference and we are receiving over 5,000 abstracts. And you expect me to read all those 5,000 abstracts? Of course, even the reviewers, sometimes they cannot be able to do that. One of the things that they will be able to do, they look at some of the things that may be able to disqualify an abstract. Your title, look at it. Your background, how you just structure your work is very, very critical. And in terms of the topic, looking at those elements, basically, I've just indicated some of the key questions that you need to consider. You need to consider when talking about your title. Make sure you align that title to the thematic areas of that particular conference. With the moment you are running the opposite direction or a different direction, be sure that abstract is likely to be rejected. And so make sure your abstract title is associated or aligned to a particular thematic area, and it's very specific and informative. Make sure you are specific. Don't write a title that has 30 words. By the time you are reaching on the 20th word, you are already lost on what this person wants to do. So be very specific. If you are doing a quantitative study and you're saying A is related with B in a particular area and all that and that, let that be clear enough. Let that be clear, because when you are looking at a title, I want to be sure, I want to be clear that some of you know how the components of a title that you really need to be able to know. So if today I was to talk about a title, I would definitely give you the components of a title. But this is a webinar. A webinar gives you a general idea of what you need to be able to focus on. And so the components of a title is very, very, very critical. Some people use the PICO kind of technique to draft their title and even their objectives in one way or another. And so you need to be able to know what are the components of a good scientific title. And so that's very, very, it has to be specific and informative, and make sure you avoid very generic topics or vague languages you're using. Don't use a vague language. Vague topics or generic is simply rejected in one way or another. And so it's very, very critical for you to be able to ensure you know that. And in the background and rationale, don't give us stories. Give a simple statement of the context of the problem. It can be 1 or 2 sentences. A simple sentence on the context. You don't have to even give references because you have already read quite a lot of papers. And one of the things, if you are a good writer, as you are developing yourself to be one, be sure that when you are writing even an introduction, just an introduction, there are 3 things. There are 3 things you need to know. If you are writing a good research paper, you need to know what is already known. What is already known. You need to also know what is unknown. What is it that is unknown? And that is why some people even go to an extent of conducting a scoping review. A scoping review is different from a systematic review of literature. But a scoping review scopes for all sorts of literature within that particular field so that they can be able to see what has already been done and what are the gaps that are still existing. And so giving you the aspect of what is known, what is unknown, and then probably if you are talking of a hypothesis or a particular objective, then you talk about, are there studies that are supporting my objectives? Are there studies that contradict my objective, or rather do not support my objective? Are there studies that did not find any difference at all? Those 3 components are very, very important. And so you need to be able, and those that actually brings out the gap gives you a clear context of the problem. Giving you a clear context of the problem, whatever has been done, what has not been done, and what is yet to be done. Those are very critical. And so when you are writing that in a short sentence, I may not go into the nitty-gritty details because I know experts are already going to be in that particular conference. There are things they already know. They know the context. Some of them know the context better than you because they are professors in those particular fields. And so they know those things that are existing. They are well-versed. And so bringing it an idea that challenges the listeners is very, very critical. And then you need to be able to identify by justifying why this is important. Why this is important, and is it grounded in the previous studies that have been conducted? And so that's very, very important. I might take your paragraph of your background in an abstract, and taking that background in an abstract, I would be able to critically evaluate and identify all these things if I'm an expert in that particular area. And in writing your question, make sure you ask yourself, is it clear? Is it clear? Is my research question clear? And one of the things when we are writing a grant proposal, we always give our colleagues or even people who are not part of the research team to read the research objective. And the research objective nowadays, we talk about smarter, not being smart. Research objective must be smarter. Smarter. I know you know SMART, but ER, some of you might be still struggling with that ER at the end. It must be specific, it must be measurable, it must be achievable, it must be time bound, it must be evaluated by the team members. The team members really need to evaluate this research objective and simply say, hey, is this objective what we really want to go for? Are we really going to do this? And the team members have to evaluate the research objective. You can be able to have even several research objectives that are associated with what you want to do, and let the team members evaluate them. If these research objectives are clear enough, they are measurable, they have to be able to be evaluating those research objectives. And the last aspect of it in writing a research objective, it must be reviewed. Give it to somebody who is not part of the research team to just review it. Give it to review it, and ask this person if they do clearly understand what you want to do. I mean, you can be able to give me your research objective, and of course, I already know what you want to do. If I struggle to understand your research objective as a researcher, then there is a problem. Already there is a problem. I cannot be able to understand what you want to do. Be sure that's not a good research objective. And so you really need to be able to make sure that your research objective, there are also components, elements of a research objective. So you really need to be able to understand the components of a good research objectives. And so what are the things to avoid? Please avoid being vague. Writing something that nobody else understands. If a reviewer takes that paper, they don't understand. So your research objective must be smarter, not smart. It must be smarter. And in terms of the methods, as a reviewer, these are the questions that I ask myself. Based on this particular objective, I look at the question, is it a what kind of a question? Is it a when kind of a question? Is it a why kind of a question? Is it a how kind of a question? Is it a where kind of a question? Every kind of a question that is being presented in a research objective must actually be having an appropriate method that really needs to be used. And so I will ask myself, I'm an expert in this field. These are the kind of methods that we have been using to do this kind of a question, an objective. And this person is bringing in something that will dilute the findings of this particular paper. Then I will start questioning even the findings of that particular paper, of that particular research. I will look at even, your sample. I will look at, is it adequate enough to answer that particular objective? I will look at, the data collection. By the way, I'm also a biostatistician and epidemiologist. And as an epidemiologist, we look at the determinants of the disease and all that. And by looking at that, we have to identify different kind of methods that we are using for a particular research question, which are strong enough that will be valid to answer a particular research objective. So when I'm looking at your conference abstract, I have to identify, looking at evaluating your objective, and look at the method that you have used to answer that particular objective. And if it is weird enough, I must admit that I'll start questioning your results. And is it feasible? Is it ethical? Those are some of the things that sometimes people write objectives that are too ambiguous in nature, that you wonder whether they were able to do this. They were able to do that. And so those are some of the things that you need to understand. Avoid unclear method. The finding reflects what you did. And be sure in a conference, we are interested in what you did. Sorry about that. Did I lose? Okay. Now, what I'm saying, the finding reflects what you did. I, as a researcher, I want to know. I want to know the new findings in a particular field, in this particular area, in my area of expertise. This is very, very critical in a conference. What are the critical findings that we are having? I have read a lot of papers in this particular area, and I have seen, I have known, I am well versed. I am even have been cited in one way or another in this particular area. I have known quite a lot of things. This is my bread and butter. My research area is focusing on ABCD. I have won grants to do more research in that particular field. And so how, as a researcher, a senior researcher, I would want to know what are the new things that are coming out? And are they clearly presented? Are they aligned to the methodology? Are they supported by the existing evidence? And probably sometimes you are doing something that the originator is even present in that meeting. And you are wondering, is somehow sitting down and wondering whether this person did exactly what should be done, whether this person actually read a particular paper, the research paper that was done before. And so it's very, very important. Very, very, very important. But if your work is still in progress, if your work, that is the good thing with abstract, conference abstract. If your work is still in progress, you can be able to show the expected outcome. It doesn't necessarily mean that, you know, in every conference abstract, you must have your findings. There's some research that are still going on, and you, looking at the trend of what you are doing, you are expecting some kind of, you know, a finding based on the pilot studies you have done. You are expecting some kind of an outcome. You are free to, you are allowed to present the expected outcome. You are allowed to do that. And that paper can be accepted as a conference paper. And in terms of the interpretation and conclusion, what we want to see whether it's accurate enough. Is your interpretation accurate? Is it linked to the findings that you actually presented? And are you supporting your conclusion, you know, with the data that was there? The data actually can be able to give you a conclusive finding. You got A, B, C, D, yet in your conclusion, you are giving us E, F, G. Totally a different thing that is not related with the finding. And sometimes we always see those kind of conference papers that, conference abstract that people are presenting. And you know, we as reviewers, sometimes we of course we don't fight the author, but we give a clear kind of evaluation on what we think as reviewers of those particular conference papers. And so what you need to do, avoid being overgeneralization. Avoid overgeneralization. Don't overgeneralize your finding. That you, for example, you got that. Let me give a quick example on one of the current study that we did. That when we give supervisors of graduate students a very good and well-packaged kind of kind of remuneration in terms of incentive to make sure that they supervise students well. That was in a study that we were doing, and we gave master scholarships to particular students. And after giving master scholarships to particular students, about 15 of them, and we distributed, 8 in one university and 8 in another, and 7 in another university. And we decided to give incentives to these supervisors. And what happened? Do you know all these students graduated on time? Within 2 years, all of them had graduated. But the students who had joined and their supervisors were not being given incentives did not graduate on time. Some of them are still in school. So we came to realize that also the kind of incentives that are being given to the supervisors of graduate students is very, very critical to make sure that the students graduate. And that's one of the findings that we got. And so we can't overgeneralize it to the entire kind of a globe. We got it in a particular country. And if we got it in a particular country, which I don't want to mention, we can't generalize it in a particular. I happen to study in the Western countries, and there's the system works for you. You do what is required, and you graduate on time. You don't do what is required, you don't graduate on time. Yet in Africa, many students don't graduate because partly because of supervisors. Maybe supervisors are not insensitized so much so that they can be able to help the students, work with the students so that they can be able to graduate. But we cannot generalize it, overgeneralize it to the entire globe. That was specific to a particular setting. It might be probably specific to Africa, but not to the entire globe. And so you have to look at whether your results is being overgeneralized. A moderator, you'll tell me if I am going above the time indicated. I don't want to go above the time. I like keeping time. And in last but not least, looking at the policy implication, it has to be clear enough. It has to be linked to evidence. What is going on? We have a problem in our country. For example, Kenya. I'm a Kenyan. The problem is our healthcare system. We have introduced a new universal healthcare coverage, that is SHA. But many have not registered for this SHA. That's a problem. What could be the reason why many have not registered for SHA? Could there be an issue? And linking, if you have a finding that could be able to be associated with a critical policy issue, link your evidence with that critical policy issue that is coming out. Make sure it is coming out clearly and without being vague. Then on your language, the last thing we look at, avoid grammatical errors, avoid spelling errors. Those are simple things that keeps people off. Look at your writing style. Make sure you follow the format that has been given as a guideline. Every conference, they always give a guideline. If they tell you that we need 250 words, don't give us 251 words. It is 250 words. Give us that. And don't use a politician tone when you have found a very critical research. Don't use a politician tone. Sometimes we are tempted to use, try to speak to the policymakers in a political way, but in an academic paper, in a scientific paper, use academic tone. Don't be political. Otherwise, your study can face a backlash from the politicians. Of course, one of the things you have not known, and you need to know, that the noisemakers are the rulers of the world. The noisemakers are the ones ruling this world. But the academicians who are diligently doing research, they are not the presidents. You know, so the noisemakers can carve even a lie to be truth. And that's a fact. And so if you are presenting your results, avoid a political tone, use academic tone, because you can be able to be, your paper can get a backlash, especially in high-income countries where they are concerned about evidence that has been found. You know, they don't build policies based on any other issue apart from evidence. They look at evidence, building policies based on evidence. What is the evidence that has been found? One of the critical things that while I was, there was a time, for example, as in a Kenyan government, there was a time in the legislative government, they were discussing about legalizing polygamy. And then something came to myself and ask myself, hey, why must we debate about legalizing polygamy? Is it good for health? Is there evidence that indicates that polygamy is good for health? And so I started wondering. And of course, I did a research on that, eventually did a research on that and found evidence, a little evidence on it about, family structure. That paper is published out there, family structure and utilization of antenatal care, in Kenya. And that paper is published out there. I shared that paper after finding, critical results. I shared that paper with one of the legislator who is my friend to look at it. But that paper did not see light of day because it's a man's world. It's a man's world. The parliament is a man's world. And so majority of men voted for it. Voted for polygamy for reasons known to themselves, but they did not use the evidence, or nobody ever discussed the evidence that has been found. So one of the things that is very critical as you are presenting yourself, present your paper as an academician, using an academic tone, because if you present it as a political backlash, then you will also get equal reaction of backlash in terms of what you're doing. And so some of the red flags you need to watch for, missing research questions. We have seen papers that are being presented, but they don't present the research question. The details of methods section, they don't give at all. And they make conclusions that are not supported by the data that they found. And, the mismatch in the abstract element and poor writing and formatting skills that are there. So those are some of the things you need to look at. And in scoring, when we are scoring, there's a rubric based on what I have presented. We always use rubrics to score. What do you think about this title in a scale of this and that? What do you think about that? And give your comments why it should be like this and that. And so, we be fair. We try to be fair, but critical. We try to be very fair, but very critical. We read your work with a critical mind, a critical thinking, and we have to be fair. So when when reviewers are looking at your abstract, be sure they are not fighting you. They are just being too critical based on what you are doing. And so we always give constructive comments, and sometimes in some kind of peer-reviewed conference abstract, if a reviewer is not sure about a particular issue, they are always allowed to ask for a second opinion from another reviewer as well. That is allowed. So your paper can can be reviewed by multiple people. And most of the time, we always give at least 2 people to review a particular conference abstract. 2 people. 1 abstract, 2 reviewer, at least 2. Then we get the average score in terms of that. And so if we are targeting a particular number, then we can evaluate it on that. I wanted to actually show you one of the sample of an abstract if time allows, but moderator, if time does not allow, I will definitely stop here.
Thank you so much, Dr. Patrick. I think we can take for the next 5 minutes for us so that you can be able to show us a sample of abstract.
Yes, but before I give the final abstract as a sample, look at this one. The final tip for reviewers that we always give reviewer: stick to the standard that has been given. We always judge what is written, not what we assume, and we always be consistent and keep the confidentiality that is there. And so you will have to forgive me. I have in the conference abstract that I want to present here. If time would have allowed, I would have presented quite a number for you to see so that you can be able to evaluate. So this one, we required actually 200 words, 200 words. Already, it was 219. I have anonymized the author. Look at the title of the paper: Moderation Effect of Epidemiological Factors on the Relationship of Nurses' Competency and Effective Healthcare Delivery in Private Hospital in Ga East District. Hey, I'm already lost. As a reviewer, this title, you look at it, you are already lost. You are already lost, and this is true. These are the kind of conference abstract that people present. Give somebody your title to read. Moderation effect of epidemiological factors on the relationship of nurses' competencies. Oh my. I don't know. From the title itself, you don't know what the person wants to do. And then a semicolon, basis for a model. So I asked myself, what is the basis for a model? Is it moderation effect? Is it epidemiological factor? Is it the relationship? So you ask yourself a lot of questions as a reviewer. And then you go to the introduction. The introduction is too long to me. By the time I am reaching the objective, and you can be able to see here, the current studies 6. Look at the spelling here for 6. S-E-C-K-S. I'm already figuring out what is going on here. So you know, some of those things. Anyway, I'm sorry if the owner is here or somebody who knows the owner is here. Please forgive me for using this kind of an example, but I didn't want to go into detail. And then by the time they are presenting their results, I'm trying to figure out, looking at the objective, looking at the title, looking at the results. I'm wondering what was going on here. And me as a reviewer, I'm already off. Back to you, moderator.
Thank you so much, Dr. Patrick Owili, for those great insights. We have quite a number of questions, around 6 of them. Hopefully we'll take the next 10 minutes to respond to each one of them. And we have a question from Idris, and he is asking, can perspectives or commentary or policy briefs be submitted for abstract presentations? And how do we write the methodology section for narrative reviews for an abstract?
I want to say yes and no, depending on the conference. If the conference requires you to actually present perspectives or commentaries or even policy briefs, then go for it. go and do it. But if they don't require, every conference will be able to give you a guideline. They will be able to give you a guideline. But I know most of the time, perspectives, commentaries, I'm a journal editor. Actually, I'm an editorial in the editorial board of 3 journals. One of the things, you can be able to present a perspective to the editors. You can be able to present perspective to the, commentaries, or even a particular brief to the editors, and think so that they can be able to see if they can be able to publish it. That is allowed. Journals do allow that. But as for a conference, unless their guideline states that you should be able to present a perspective, then go for it. But if they don't ask you for it, go for what they ask for. Otherwise, those are the bases where, some of the papers are being rejected. Conference papers are being rejected. They would simply tell you, well, due to many applications and the high number of applicants that have been there. Sometimes we try to be kind enough. We try to be kind. Because of the many applications that have been there, many abstracts that have been submitted, we were unable, even though yours is very good, it's very good. It's very good. We don't deny that. It's very good. But unfortunately, we are not going to accept it at this moment. So we just try to be kind enough. But make sure you follow the guideline of that particular conference. If they require you to be able to, you can be able to present a perspective, go for it. You can be able to present it, and make sure you follow their guidelines. And a narrative review. A narrative review. Yes. Just the same way. There are several approaches to different kind of review. There's what we call the scoping review. There's a systematic review. There's a narrative review. There are quite a number of kind of reviews and each of them have different methodological approach that are being used. And if you have to, for example, if you are doing a systematic review, have you used the Prisma kind of technique to, exclude the papers among all that? And so that really needs to be clear. In the scoping review, there are 5 critical steps. 5 critical steps that really needs to be identified. And if you don't follow those critical steps, then you are going to present the method section in an awkward way. And so if you are talking about a narrative review, there is an approach towards conducting a narrative review, which you really need to be able to present. Yes. So in the method section, write briefly the kind of approach that was used. Yes, back to you, Malkia.
Thank you. And Christine asks, what determines if a paper qualifies for a poster presentation and not oral?
What determines if a paper qualifies for a poster and not presentation? Sometimes I want to be fair enough to the conference organizers. Sometimes there is quite a lot that really they have to deal with in terms of the numbers. And when the numbers are too much, and bearing in mind the conference is probably for 3 days, you can't have everybody to present. You can't have everybody to present. And so one of the techniques that the conference organizers do actually accept is to organize a parallel kind of approach based on specific thematic areas. So we want to accommodate a few people to present in this parallel proceeding, and these other few people to present in this parallel proceeding. Not everybody can present because of time element. And so we would suggest that this particular conference paper should be presented in terms of a poster rather than being able to present orally. Much of the time, it's all because of the time element of it, and this, the number of applications that do qualify, that are very important, that we feel are very important to the conference. So those are some of the things that we do look at. I hope that is fair enough, so that you don't hang the conference organizers, because all of them that have been accepted are very important, but because of time element of it, it is important that they need to consider those that goes for oral and those that goes for poster.
Thank you. And then there is a question asking, what's your advice for tailoring the same research to different conferences or audiences?
Now, tailoring the same research to different conferences. And now, one of the things you really need to be aware of, it's only that most of the conferences, some of the conferences don't publish the conference papers. But ideally, every conference paper should be published. Every conference abstract should be published. And it is important for you to know that. So imagine if it has already been published and you want to present it in another conference. Don't you think, and that other conference would probably think of publishing it if that conference paper is supposed to be published? What would you think will happen? Don't you think you are going overboard in terms of scientific credibility? And so it is important when you are presenting your conference paper, target one key area and present it. If it's a conference that always publishes the conference abstracts, thank God you have been published as a conference abstract. Yes.
We have an anonymous question here. Being a peer reviewer, is it contraindicated to present a concept that is due for publication in a journal if it has not yet been published?
Being a peer reviewer, is it? I didn't get that word. I lost you a little bit.
Being a peer reviewer, is it contraindicated to present a concept that is due for publication in a journal if it has not yet been published yet?
Of course, yes. That's allowed. That's allowed. That's allowed. And much of the thing that you are definitely presenting, for example, there's a paper which was published by the BMJ. That was a conference paper from a research that we conducted, was funded by the EDCTP. It was funded by the EDCTP, and the BMJ published it. And we felt that because BMJ has already published the conference abstract, why don't we now develop the full paper and send it to the BMJ now as a follow-up? And that's the practice. That's the practice. You go to a conference paper, and one of the things that you are definitely going to meet, you're going to meet journal editors also in the conference who are looking for critical findings that are suitable for their journals. And that's very important. And so don't shy away from presenting in a conference, because an editor can be able to approach you to submit a full paper. To that particular journal. And so it has happened to quite a number where they presented new findings in a particular field, and the journal editors who are present in a particular area approached them to present, or rather develop a full manuscript and send to that particular journal, and they were published. It happens. Yes.
Thank you. The final question is, in your view, what makes an abstract memorable to reviewers and participants?
What makes an abstract memorable to the reviewers and participants? Simple. The simple advice I have given you, just do your best and follow the guideline as presented. Make sure you don't deviate on other things, telling people that you know, yet there are people who already know better than you. Just follow the simple guidelines that are there, and it will be memorable. And if in any case you have new findings, things that are very great for that particular field, then be sure you are ready to go and hit big in that particular field. Back to you, Malkia.
So finally, we have quite a number, like 3, requesting for coaching opportunities on how to get better in writing an abstract or other specific scientific documents.
Opportunities of how to get better?
They want coaching opportunities, I think mentorship.
Oh, coaching opportunities. Well, one of the things we do, especially in our organization, we have the capacity strengthening kind of component where we have senior researchers who are, capacitating researchers in Africa. And that's one of the key. I'm glad I have mentored over 50 students, graduate, master's, PhD, and undergraduate students. And, so the mentorship, building up a people who can really do great things is very, very critical for some researcher. What is it that we remain with after knowing quite a lot, after doing quite a lot? What is it that we remain with is to mentor someone. You cannot go a long way if you don't mentor people. Of course, there are opportunities, several opportunities that are there. There are those that are funded. There are those that other organizations fund. I do remember even in our organization, we have what we call the BISCOP kind of training. The BISCOP kind of training where an organization approaches us and tell us, hey, we want you to train our people on how to do this. We have done that quite a lot with several organizations on grant writing, manuscript writing, grant proposal writing, among other areas, quantitative analysis, among other areas, the qualitative analysis, systematic review and meta-analysis. Those are some of the things that we have mentored people on quite a lot. But if you have identified specific people who are good, be their friends, work with them. They will be able to help you out in doing all those things. And so there are mentorship opportunities quite a lot. There are those that are funded. In my organization as APHRC, we always give internship opportunity, paid internship opportunity every year. Last year, we gave internship opportunity for 60 interns. And this year, we gave internship opportunity for about 55 interns. And so we also have visiting scholar kind of opportunity in my organization. And I believe several other organizations have those kind of, opportunities to help people grow. That is part of capacity building of researchers in Africa. Yes.
Thank you so much, Patrick. And I think we can continue engaging, responding to some of the questions as I usher in Patrick Mula, Dr. Mula, to just take us through on how we can submit our abstracts. And as Dr. Mula joins, there is an appreciation to Dr. Owili in terms of the presentation is an eye-opener and even a game changer. And thank you a lot. As Mula gets in, I must confirm, I think I'm one of the beneficiaries on grant writing from APHRC, so capacity strengthening is happening there. So Karibu Emmanuel for the next 5 minutes.
Thank you, Patrick. Thank you, moderator. I can also confirm I am a beneficiary of APHRC. I think my take home is learning is the only thing that the mind never exhausts. That is a quote by Leonardo da Vinci, and basically I've picked from Patrick that your objectives have to be smarter. So how do we submit abstracts to the second Nairobi Health Scientific Conference? I've shared in the chat a link, and when you click on the link, you're able to see this kind of screen. Moderator, kindly confirm that you can hear me.
Yes, we can.
Thank you. So you will see the Microsoft CMT platform, the link through which we are accepting abstracts from everyone. At the bottom, you will see the logo for the second Nairobi Health Scientific Conference. When you log in, I have already created my account, so I will not register, but in case you are new, you have a chance to register. And when you're doing registration, you do not need to, there's a page that requires you to fill a lot of details, including a lot of details, but basically including your Google Scholar articles and the like, but you do not need to fill in anything. You just need to fill in your email. And after you have activated your account through your email, you basically have your email and your password. So when you log in, it gives you this kind of screen. So you are an author, so it gives you the author console. One of the things we advise that you do as an author is you click here to view the welcome message. The welcome message basically has the author guidelines, or rather submission guidelines in summary. So just reading through, abstracts should be submitted in English only. They may either be scientific or best practice. That answers a question that had been asked, whether policy papers, commentaries are allowed. So we're only accepting scientific studies or best practice. So the abstract should have the background methodology, results, conclusion, and that Patrick has clearly elucidated. The best practice abstract should have a similar format, a background, description, and lessons learned, as well as a conclusion. Then you're also directed to post the abstract body in the text area. We shall see the text area, and only supplemental material such as a picture of best practice abstract, which could be an intervention or an approach, should be uploaded. So how do you then submit an abstract? So you create a new submission, you fill in your title. You are supposed to have already developed the abstract, so you basically paste it there. The abstract is 300 pages. If you read the submission guideline, 300 words. 300 words is about 20,000 characters. And I think on this, Patrick has reinforced, we are basically looking for 250 to a maximum of 300 words, not more. Then you can, of course, you'll already have filled in your email. It's pre-filled because you have created the account. So you have your first name, your last name, as well as your organization. I'm from Nairobi City County. You are then allowed to select a primary and secondary subject area under which your abstract falls. So the primary subject area is basically the sub-theme. The secondary subject area is basically the track. So this is on the call for abstracts. You can easily pick it. So you select one. And then finally, you can upload a picture or probably any supplemental material to go alongside your abstracts. For scientific abstracts, we do not expect any uploads. For best practice abstracts, we probably expect a picture of the intervention or approach, just to make it clear what you're talking about. And it's only one that is allowed, and thereafter you submit. So it's as simple as that. The question then comes, why should you submit abstracts to the second Health Scientific Conference? Number one advantage is that you're able to share your research with high caliber individuals who shall attend the conference. So your research could either be a study that is complete or best practice approach that you found at your workplace or your facility, because I'm sure most of us who've joined the healthcare workers. And the other advantage is that there are limited sponsorship slots for both scientific and best practice abstract. So when you submit and your abstract is accepted, we are likely to give you a sponsorship, which means you will attend the conference without paying. Number three is that the abstract shall be part of the book of abstracts, and In case, for instance, it's a requirement for your graduation, this would go a long way in helping you ensure that you meet that target. Finally, this is still work in progress, but we hope that for this year, accepted abstracts can be published. We're exploring several ways of doing this. Thank you, and back to you, moderator. I look forward to seeing a lot of your abstracts, and with a high caliber team of reviewers, seeing what quality or seeing a high quality abstract that shall be submitted, presented in the conference as both oral presentations and poster presentation. Thank you, and back to you.
Thank you so much, Dr. Muller, and we hopefully to see so many abstracts. Remember, this year's conference will be bigger, better, and transformative. As we come up to a wrap, I welcome our speaker to just give us one word as we close. Dr. Patrick, just a closing remark. Do we still have Dr. Patrick Owili here?
Yes, you have me.
Yeah, a closing remark.
No, it was my pleasure, meeting you once again, Malkia, Emmanuel, and others. It was my pleasure, having to spend time with you once again. And thank you for inviting me for this webinar. In my busy schedule, I had promised that I will be able to, be available. And thank you once again for the invite.
Thank you so much. Thank you all for joining today's session. We do appreciate, and a big thank you to our speaker once again, Dr. Patrick, for the great insights. We appreciate. Much appreciation to the Kenya National Hospital for the collaboration, and the Nairobi City County for creating this platform for knowledge sharing. Kindly look out for our announcements on our next webinars, and also look at our NTCG website for more details on registration and submissions. Kindly do not forget to submit our abstract. We are still open until 1st September 2025, and we look forward to seeing you all at the conference in November, because as I've said earlier, it will be bigger, better, and transformative. Thank you, and have a good evening. Asanteni.
Thank you, Malkia, and bye-bye.
Bye-bye.
Thank you once again to the Nairobi County team, and Patrick Owili for the wonderful presentation today. This session's recording will be uploaded to our YouTube page, that is KNH Research, or you can search for KNH UN webinars on YouTube. Be able to get our past recordings. We'll be back tomorrow with a session on Nairobi Cancer Registry, which will be looking at population-based cancer registration. A team from KEMRI will also be taking us through this, so do kindly join us for this session tomorrow. Thank you once again for joining us today. Do have a wonderful afternoon and good day.
Thank you.